Did you know epilepsy is the fourth most common neurological disorder and affects people of all ages? Hi, I'm Emily Connor, and I'm here to speak about what epilepsy is, how it affects people, as well as some myths many people believe is true about this misunderstood disease. First things first, let's talk about what epilepsy actually is and what it has to do with seizures. Epilepsy is a chronic disorder in which people have reoccurring, unprovoked seizures. Many people with epilepsy have more than one type of seizure. Some types of seizures are grand mal, which is the worst because it is the most physically and mentally exhausting. Then myoclonic, clonic, tonic, and atonic, which are all mild, brief moments of unconsciousness. Epilepsy and seizures can develop in any age in any type of person. Factors such as health conditions, age, as well as race even affect your brain. Oftentimes, epilepsy will commonly develop after a traumatic experience. This may include a fall or anything that can disrupt the brain patterns. So basically how the brain works is it's made up of millions of neurons, which are basically little brain cells that communicate with each other via electrochemical messages. If something disrupts this communication, this can trigger a seizure. So the brain is divided into several different regions. The first one is the cerebrum, then the brainstem, and the cerebellum. The cerebrum is the largest and most recognizable. This area is most involved in epilepsy. The brainstem and the cerebellum are both not involved in epilepsy, and that is the reason being is because most of the communications between the neurons occurs in the frontal lobe of the cerebrum. However, if you injure the brainstem or the cerebellum or the cerebrum, that can trigger a seizure. A test that can be used to determine if you have epilepsy or any dysfunction in your brain activity is an EEG. This is used to determine if your brain waves are abnormal. A nurse places electrodes that record your brain waves all over your head. First, they mark your head with a pencil to indicate where electrodes go, and then they use a special adhesive to attach the electrodes to your scalp. This test can range from 2 hours to a full 24 to 48 hours, depending upon what they are trying to determine. The reason I'm speaking about this is because I've had epilepsy. Thankfully, I'm 6 years seizure-free, and I've been cleared of my disorder for 3. After medication for 5, I've reverted my diagnosis. Many times, epilepsy is associated with people who cannot function in society without precautions. Many people with epilepsy are limited with driving, roller coasters, certain types of movies and lights that can trigger seizures, and this can be very limiting for anyone, even especially kids who are growing up with epilepsy. I've lived most of my childhood and tween years as an epileptic, and I assure you, as a child, it did have its limitations. However, growing up and being diagnosed at a young age was a gift for me. I grew up understanding my illness through many blogs, such as epilepsy.com and Help Me With My Epilepsy. They are both blogs that have a very valuable research because they allow outside sources and normal people like me to write entries and talk about what I'm experiencing with this medication or what I'm experiencing with different stages of my epilepsy. When I was growing up, I didn't really understand what it was, and having these type of blogs gave me an outlook and made me understand more of how I was going through something that's similar as someone else. Honestly, as an epileptic, you really don't recall or remember anything about having a seizure. Epileptics can function as normal people in everyday life, and you might not even know that they have this. I hope this presentation has given you more insight and knowledge about epilepsy as well as seizures. My name is Emily Connor, and thank you for listening.